Please do. Just a few minutes past the hour, and I'm sure we'll get a few more joining us, but I'd really like to welcome you all to this session on CMOs of the future, global horizons, broader prospects, maximise potential. I'm really just here to chair the session and introduce your two-star speakers of the day, Rikard Moen and Dr. Rajgopal, or I call you Raj. So if you're okay with that, Raj, I'll continue to do so. Perfect. That would be great. Yeah, welcome also everybody to what is the fourth of a series of leadership webinars. We're all recognizing that when we take these jobs, actually more and more we have to take the technical skills as read. I say as read, it doesn't stop us having to validate that people have those technical skills, but it's often the leadership skills that differentiate how effective we might be in our roles. And let me get, you doing the slide, so let me move on to the next slide. What I would say though, in the time of COVID that we're in now, we are seeing an absolute resurgence in the levels of interest around chief medical and chief health officers. These are just a few articles that you may wish to Google or pull out, just to give you a flavour of the breadth of that. What I find most interesting is, particularly when I look to my colleagues, we all come from very different backgrounds in terms of our training. We have basic training in a healthcare profession, often in medicine or nursing or public health. But actually, it's that experience that we get through the different roles that we take that actually set us up to advise at a board level in very, very different settings. There's some real basics that actually are very universal, even though the roles themselves and the industries that we might be speaking to are very different. I think when I look to my co-speakers today, one thing I would say is that we absolutely come in with a passion for what we do, an absolute passion for what we do. Each one of us have spent time in very, very different environments, but we share that passion about health, work, organisations, and how we can make a difference, how we can make a difference to workers, how we can make a difference to the public's health, and how we can make a difference to the success of organisations and, in fact, economies. I was on a call just a bit ago, and somebody asked me about the artwork in the back of my study where I'm standing. It's in fact it's nowhere near the value of Dr. Raj's collection, but just to my left is the Stoke Potteries, where I was born and brought up, where I was probably most exposed to silica dust grinding the base of Dalton figures. Where the protection of the least valued member of the person in the workforce, i.e. me, was very little, no protection, but actually the support of your peers, getting to know how things work and how to deal with them, really was one of those moments that set me on the road I've been on. I was told that if you chip the figure, you can put it in the basket. When you fill the basket, you can take them outside, you can throw them on the wall so they don't get sold as best figures. And that's the best way of getting away from the dust. Now, in that little small vignette is everything about what we do. We need to protect the most vulnerable, and COVID has absolutely shone a light on that. When you don't protect the health and safety of workers, you actually destroy the value of your company. And that company there are no longer any Dalton companies in the UK, and those figures are made somewhere else. And people did not see the value of the worker, and they did not connect the value of that worker to the organisation. And I think those small lessons actually we carry with us on our journey to the roles we play today. So I'm currently the Vice President of Health for BP. We have 65,000 employees in over 65 countries in all sorts of different environments, from the very, very hot to the very, very cold to the very, very remote, where healthcare systems are poor or great, where regulations are difficult and politics are difficult, and security and other risks are difficult too, and also where the spectrum of public health, the baseline public health, is immense, and the disparities between one and the other are absolutely stark and in front of you. And that's the sort of roles that we can play in. And our two speakers are going to give you an insight into how, well, some of the challenges that we've faced getting into those roles and what keeps you there, and also how to sort of select your development plan if that's where you want to be. My parting word before I introduce our first speaker is really there is no substitute for experience, because in fact you need to make these small mistakes along the way and create a legacy of good decisions. And you don't do that if you come in too high. You do fall pretty quick. So it's nice to see an idea that I can get somewhere, but I really would suggest that breadth of experience is immensely valuable, immensely valuable. Now, what I would suggest people do is, if you'd like to put questions in the chat as we go through, I will attempt to allow our speakers to flow and give their presentations. And then, but just interject and perhaps take some of them as we go. And we should, though, have a good 15, 20 minutes if we're to time to have some questions at the end. So do ask as we go, and do hold your questions from the end. We are recording today, so please be aware we're recording this and it will be played back.
Sure.
And anyone who's not speaking, please could you go on mute? Could you make sure you're on mute? I think Chris Valentine is on. I'm just going to mute you there if I can. Great. So it's an absolute delight to introduce Dr. Rajgopal. You know, we go back a long, long time. Raj was the Chief Medical Officer, Vice President Health for Unilever. He's now currently on the board of Apollo, one of the probably the largest and one of the best hospital networks in India, and his experience is absolutely global. He's qualified to the nth degree in medicine, in business, in healthcare management, in UK and Ireland, and he's also trained in the US as well. So it's an absolute delight, Raj, to ask you to lead off the next session on the CMOs of the future. I'll pass the buck to you.
Thank you, Richard, for those wonderful words of introduction, and good morning, ladies and gentlemen. And I'm going to try and share my screen, and hopefully it should share without a glitch. Let me just see, please. Is it visible now? Richard, is my slides, are my slides visible?
Can you pop it onto slideshow and we're away?
Yes, I'm trying to do that. Yeah, okay.
Thanks, Raj.
Is it okay now?
Yeah, it's coming now. Lovely.
So lovely. So, you know, I'm going to speak about how do you navigate the corporate world and what's the role of the Chief Medical Officer. Now, this is a painting from my collection, and this really describes the dilemma of the CMO. The guy holding the oar and trying to navigate is the CMO, and on his head, you can see a lot of birds. These are the senior management, especially, who want you to do very many things at the same time. Especially, you would have understood during the COVID times, the demands on the CMOs in terms of not only being scientific, but also being non-scientific. You know, you would have heard about disinfection tunnels and a host of other things. So you need to navigate it very carefully when you want to please the C-suite, at the same time ensure that you're absolutely scientific in value addition to the organization. And down below, you see the employees also demanding the very best as far as we are concerned. So I have been asked through my 30 years of experience with Unilever at various forums, you know, how do you actually add value as a Chief Medical Officer? And I have a very simple answer for that. We blend easily into the milieu of a corporate setup if we work very closely with human resources, supply chain, and the finance people, and also the legal guys. In the space of human resources, we can actually help improve employee engagement. We have done a lot of studies and along with the Lancaster University in the UK on employee engagement. And we have found that if we are able to improve health and well-being, the employee engagement also increases significantly. And that is, of course, the end result in terms of productivity enhancement. We have seen in many parts of the world, and more true in Latin America and South Asia and Southeast Asia, that if you take care of your people as far as health and well-being is concerned, including mental well-being, it is a great source of talent attraction as well as talent retention. And in many parts of the world, we also have a policy of caring for employees even after they retire. And this is a huge bonding mechanism by which you can actually retain high quality employees. In the space of financial value addition, most of you must be advising your organizations on third-party insurance, on health insurance and stuff like that. But the key thing is that study after study has now proved a return on investment. Later, I will show you a chart about Unilever, which talks about how much do we actually get for every euro or dollar invested. And the most recent one is in the space of ESG, environment, social, and governance. Our activities as an organization can impact the environment. And do we as occupational health professionals have the bandwidth to even look at environmental health and start supporting the organization in reducing the fallout of our operations? So whether it's a sustainability agenda or protection of corporate reputation against various cases against the organization, or just meeting the plain OHS legislative standards in a different country, we all have a huge role to play. Now, this is something which I actually developed in-house for Unilever and which we have used over the years in terms of what sort of a skill level do you actually need to be able to lead a big corporation. For instance, in Unilever, I've been heading around 165 countries across the world in terms of, along with the team, of course, providing occupational health services. I started my life as a factory medical officer in a factory in Mumbai in India, and then rose to become the chief medical officer for the Indian company, which was Hindustan Lever at that time. That company grew by mergers and acquisitions. So did my role grow. And then the organization gave me charge of China, then Asia Pacific, then South Africa. And finally, they elevated me to being the global head after I did a stint for Central and Eastern Europe. And as I went along, I realized that the skill sets, the professional skill sets which we need are different in different roles. So I've classified them into almost 8 different groups. So you need to be very good in terms of occupational health strategy as you move up the ladder. You must be good at risk assessment, ergonomics, epidemiology, emergency care. Many of us, who are occupational health physicians, actually don't feel that clinical support and emergency care is a part of our armamentarium. And here I think we are making a big mistake. Because I'll tell you that if you are able to take care of your people when they are not well, I don't say you need to be a super physician to treat them yourself, but at least if you know the simple basis of diagnosis and referral, and you're able to get them the best possible support, you will have the organization bosses eating out of your hands. You help the C-suite recover from an emergency as far as they are concerned, the family is concerned, the top management is concerned, the general employee is concerned, your value goes up exponentially. And then occupational health is an icing on the cake. Please understand it can't be the other way around. So we may be extraordinary occupational health physicians, but if we are unable to mix and marry clinical medicine with occupational health, I think we'll lose the cutting edge as far as being a CMO is concerned. Then I also look at public and international health. This is now extremely crucial. You would have seen how epidemiology and public health capability plays a huge role. Suddenly there's a huge clamor for chief medical officers across various organizations. I have now retired from Unilever from January, but the amount of calls I still get from headhunters is not amusing. I get a lot of calls, and sometimes I'm actually tempted to get back into the ring, but more about that later. So then you progress from a factory to a national to a regional doctor where you look after maybe Europe or maybe Africa and stuff like that. And you can see the skill matrix, what increases, in terms of this is almost similar, except that here you find that the OH strategy goes up. And at the global head, you need to be cutting edge as far as OH strategy is concerned. And you also need to improve your entire armamentarium with reference to public and occupational international health. So skill level 2 is a basic appreciation. Then you have a working knowledge, which means you can just get by running it in your unit. Fully operational skill means you can engage with an expert, and leading edge means you are the expert. So that's how you actually look at skill levels. And this is a busy slide, so I won't go into it except to say that the various component of each of these professional skill areas are identified here. For instance, in ergonomics, what you need to do in epidemiology, or in public health and international health. And here I just want to pull out a point that you need to have a rapport with leading international organizations like WHO, ILO, ICO, Medicam, and other leading NGOs. In this COVID crisis, I would have also added, CDC and other institutes of repute, because you need to be constantly on the ball. And huge networking within the CMOs network is extremely important to be abreast of what is happening elsewhere. So you don't need to reinvent the world. So these are the sort of elements of skill.
Raj, those are the skills in the roles. How do you find you have to mix the skills in different locations? Unilever, we're a massive global footprint, but you need very different skill sets in different regions. How did you address that?
Yeah, you see, in many parts of the world, if you actually look at this sort of a chart, these are broad generic skills in terms of various components of the professional skill which you possess. In some cases, if you don't have the skill, you must at least be able to access these skills. So I'm talking about getting outsourced help wherever you don't have the skills. And then training is an important component, Richard. You will find that in some parts of the world, you don't get training. So we encourage people by giving them an opportunity abroad or by attending short courses. It could even be online. But the fact is that you do encourage people in terms of skills development. So now I come back to, what is the key role which we play? I think many people in occupational health prefer to work in silos. You are there in the clinic, you come and you give a fitness to work, or you say this is not fit or this is not happening. But I believe that if you're sitting in a factory, you need to get out and go on the shop floor almost on a daily level. That's how you understand the interaction and interplay between supply chain, between safety and human resources and health. For instance, when you look at health protection, you can help on the shop floor by undertaking a health risk assessment, ergonomics evaluation, control of musculoskeletal disorders, huge stuff. So again, all these building blocks are put here. But the key thing is that you do need to work closely with partners in human resources, in occupational safety and supply chain to be really able to bring value to your job. To me, I see the CMO as the glue which actually directs these group of people to do what is important. Don't get overawed by people in human resources or supply chain. The level of knowledge as far as occupational health is concerned is surely less than what we have as a collective group. Use it to your advantage to ensure that those people fall in line to support you. You will need to work very closely with these groups to be able to add value. Now, this is just the way in which we formulate our strategy. Everyone has a different way of formulating strategy. So, in Unilever, we had this very strong sustainability living plan, which spoke about improving the health of 1 billion people on planet Earth. So for us to dock into that sustainability living plan was very easy. And therefore, we said charity begins at home. We should first take care of our employee well-being. So selling this concept to the organization, maybe I'm just plain lucky that I'm working for an organization which already had a purpose behind its mission of sustainability. I just had to dock into that and people fell along. So we had three main components: physical and mental, prevention of occupational ill health. And the most important thing is, do you have the right set of people who will help you to drive this agenda? And therefore you need a right mix of full-time people, consultants, to be able to understand, what is it that we want from them and to drive it. And under each of these, the first one is health protection. The second is first is health promotion. The second is health protection. You have various stuff which, we are put in, whether it's an aging workforce or pandemics. Just imagine in 2016, when we made this, we had already put pandemics as a big threat, because we had gone through the SARS epidemic in the past. We had gone through the MERS thing in the past. We had gone through other sorts of viruses in the past, including Ebola and all in Africa. So looking at it from a global perspective, we were very sure that sooner or later we would be hit by a pandemic, a genuine pandemic, which unfortunately happened now. So we were well prepared with, our business continuity plans, which is where again CMOs can play a crucial role in working with across stakeholders to make this business continuity plan. And at the end of it, you can only improve what you can measure. So we have a set of KPIs as shown in this chart. This is our overall well-being framework. I told you the components: physical, mental, emotional, and purposeful, in terms of what is it that brings you to work every day, so that you look forward enthusiastically to supporting the organization. Now, we won the Global Healthy Workplace Criteria, the Workplace Award in 2016. And these are the various criteria, and these are the elements of the workplace. And you have to work, again, like I said, as a CMO to be able to succeed. Please don't work in a silo. Work with the entire team of line managers and work with the top management also. If the top management is committed, you will be able to ensure that all this happens. And again, when I go back to my old chart of adding value, these are the areas where you actually add value, whether it is business ethics or continuous, improvement, or how do you actually be the leader. Our lamplighter program, which looks at health and well-being in a holistic fashion, covered around 165,000 employees, and this has been adjudged as being replicable not only by the World Economic Forum but the GBC and Access to Nutrition Index. So can we take on the mantle of leadership? We have a huge role. And the global CMO network and the SOM is such a wonderful place to actually dock our ideas and learn from each other, best practices, as I would call it. So very quickly about the lamplighter, we do a health risk assessment. We look at factors like exercise, nutrition, and mental well-being. And then we finally find out that it actually leads to an increase in performance. At the height of its program, which still continues, almost around 70 countries and 160,000 employees were covered by this. And what we actually found as an outcome was that we were able to reduce obesity, hypertension, diabetes, heart diseases, all non-communicable diseases in a good manner across various places. Now, this is something where I just want to draw your attention. Are you aware, as a group of CMOs or wanting to be CMOs, that we can now use genetics to our advantage? With an informed consent, a simple saliva sample can tell you who amongst your employees is actually more vulnerable to a particular condition. And I'm just giving you the example of diabetes here. Here I'm talking about SNPs, or single nucleotide polymorphisms. Now, these are all the ones which you find these genes, you find that they have a higher chance of getting diabetes or impaired fasting glucose, or stuff like that. So these are all indicators. Likewise, you have similar indicators for hypertension and coronary heart disease. And our C-suite was extremely impressed when we started introducing this program, because we could actually tell our people, look, for instance, somebody exercises quite a lot, and if that person has lactose intolerance, you will find that he's going to get into trouble. So exercises by running and all, whether it is aerobic, anaerobic, you can make these sort of decisions at the workplace. Guy, you can do this, you can't do this because you have a problem. And on a lighter side, when I did my own test, Richard, I found that I could metabolize alcohol very fast. Therefore, you would find me still standing at the end of 20 rounds in a pub, whereas you might fall off.
Yes, so I was there when you were conducting that controlled trial, I think, Raj, as well. You did very quickly gloss over. You said you were lucky that there was an existing sustainability agenda. Just a little bit about that, though. What you really said, I think, was you were able to integrate your agenda with the wider purpose of Unilever, and also to integrate the outcomes that you saw, the business outcomes of all those range of stakeholders that you had. I don't know about you, but I find that in fact they all correlate rather well. So you see better safety, better ethics, better retention, alongside the better well-being. It's a win-win. How did you find that in Unilever, Raj?
You see, like I said, when we set out to make this strategy, we did an exercise, in trying to find out both internal and external stakeholder feedback. And when we got that and sat together in a group, we invited people from the top management as well as the other stakeholders like human resources, supply chain, and all, to really, bring it down to what should be our key strategy. And that is when this entire concept of linking to the sustainability agenda came up. So what it did to help us was that there was a total buy-in from the organization. And then the might of the entire organization was behind occupational health as we drove the agenda forward. Because we said, and like I told you, one of the agenda was to improve the health of 1 billion people on planet Earth because of the various products which we have, whether it is hand wash or whether it is water in terms of Pureit or Lifebuoy. Even in the COVID times, hand hygiene has played a huge part. So we are playing our own role in terms of overall hygiene. So this was so easy to get the money allocated. And once we have a central program, the budget is not centralized, it is localized. So budget comes from the local area, the programs are central. So therefore, if you have a lamplighter program or if you have a mental well-being program, the rollout is across everywhere. And like I said, the buy-in is the most important thing, Richard. So that's how we were able to actually do it.
Thank you, Raj.
Now I come to this, the next portion, you would be seeing, what am I doing with an angiogram here? Now, one of the programs which we actually introduced was that when you found a number of risk factors and also the, the genetic profiling in terms of increasing somebody is at a higher risk, we offered on informed consent the chance to do a CT angiography. So it is not invasive. You just put a dye which is harmless and you take various slice cuts, depending on the CT machine, and you can get as good a picture as you do a routine angiography. Here you can see in this arrow shows, a block in one of the coronary arteries. And what we actually did was to put a stent and angioplasty. Now this is a very senior person in the organization. Today, that guy is doing very well. And God forbid, had we not done this, something which is new to at that time to many people, a preventive angioplasty as they call it, we don't know, he would have probably come down with a heart attack. So there are these decisions which you can take to help your organization. So all I'm saying is that be open to new things, new techniques. And now when I talk of new techniques, I also want to talk about artificial intelligence and also about telemedicine. Telemedicine, as I come across to the COVID thing, I'll tell you how it works. But can we help in other ways? Supply chain would be very happy if you can support them ergonomically. This is a very, very simple case study. When we have this clothes analysis lab in Unilever, everybody was hanging the cloth on the top. So each time they would raise their hand, they would have this arm, shoulder pain and all. We did a very simple thing. We just turned it on its head. I said, why do we have to continuously, in Brazil, they said, why do we have to continuously hang clothes to dry in the atmosphere? Why can't we put it down? It just changed the entire concept. With a very, very low cost, simple ergonomic solutions can go a huge way.
Raj, we have a question, really good question, actually. You're mentioning many opportunities to intervene. We always have to prioritize these things. So should we be prioritizing lifestyle interventions versus some of these epigenetics interventions, which may affect, obviously, I mean, they may be different in India with the genetic predispositions that you're dealing with, but how do you sort of prioritize your interventions?
We were very clear, lifestyle intervention first. And the starting off point was, Rikard, I faced a huge problem in Unilever when I took over as the global head in pushing through no smoking at the workplace. Finally, because I had a huge support from the C-suite and the CEO was fully convinced, Unilever today is a no smoking place. So we don't allow anyone to smoke inside. It may seem a bit harsh that we are not even giving them a smoking room. But my point was that you're diluting the standard if you give a smoking room. So then it was pushed back to me saying that, people will go out and a speeding truck will knock them over, all sorts of things to put us off track. But I think we stay the course. We tell them this is for the benefit of everyone. They listen. So that's one. So lifestyle modification is the most important thing. Then we spoke about exercise and then about nutrition. And I must tell you a very simple experiment in nutrition in a cafeteria in the US. So there were counters where, you would have the variety of hamburgers and stuff, but marked with the red flag, the WHO flag. Then you would have cucumber salads and all marked with the green flag. We said, we are not going to impose anything on you. Please go and choose whatever you want and eat. But we found that there's a huge line for the green cucumber and others, and a small line for the red. And this is peer pressure. Even the people in the red would see the huge queue on the other side and quietly sneak into the green room. So there are various ways of behavioral intervention by which you can modify the nutrition. So lifestyle modification is the most important thing. Once you have done all that, the epigenetics and all can be, like I call, an icing on the cake. Where people want it, you give it. Otherwise, I fully agree with the questioner that you must look at the lifestyle modifications first, whether it is exercise, whether it is nutrition, whether it is smoking, and now also very, very important, sleep. We undervalued the importance of sleep. And it is now very well known that if you don't get a good solid 7 hours of sleep also in the night, you are going to actually end up damaging your own health. And the most important period of the sleep is, of course, the rapid eye movement where your brain and your body rejuvenate. So my sincere request to everybody who is here that encourage, this program on sleep in your organizations. Now, this is the sort of a support which we actually gave during the COVID time. And, you're spread across the world. And when we set up factories, most organizations do that. And even Rikard would know that when you set up oil rigs or something, you go to the place where you find oil. And here we set up factories where we get the maximal fiscal incentive. And that happens in underdeveloped areas across the world. So when you go to an underdeveloped area, you don't have a hospital there, you don't have an infrastructure there. And when COVID strikes, oh my God, it's like catastrophic. So therefore, we had to help in terms of identifying hospitals within 100 kilometers, identifying quarantine facilities, providing ambulance support to each unit, and oximeters to those on quarantine. We also gave, oxygen concentrators to people. And we did something called the predictive modeling across the world in terms of understanding that if COVID strikes them, given the prevalence in that area, how many people would need ICU, how many people would need simple quarantine. So you identify schools, areas like that. So this is here that, we play a huge role. And I come back to this question of telemedicine. We have practiced telemedicine to the utmost wherever possible in terms of, sending out our reports or getting feedback and stuff like that. And you have to advise your organization on testing and monitoring strategy. Everybody must be facing this dilemma. How often do I test? What do I do to test? How reliable are the rapid antigen tests? What about RT-PCR and stuff like that? Now, when we do all these things, we also need to understand that even though we are backed by our purpose of sustainability, the hard-nosed finance guy still wants to know, is there a merit of doing everything? So this is the 8-year aggregate return on investment for Unilever, that for every dollar or euro you invest, you get close to around 2.57, out of which healthcare costs will be 1.29. Absenteeism and presenteeism is shown here, improvement. If you add absenteeism and presenteeism, it is total productivity, and everything together is total healthcare productivity. We had outsourced this to an external agency who are very adept at modeling based on the costs which you incur towards this and the outcomes which you derive thereof. And I told you we were the winners of the 2016. Now, just my last 2 slides in terms of telling that there's a great degree of personal satisfaction when you do all this on a sustained basis. And in India, we have around 15,000 employees, and supporting them and all. It actually, whether you like it or not, it brings you into the limelight as the programs like the Lamplighter and so many other programs where you want to do a lot of good to the general society. So this is a photo of me where I received the probably India's highest civilian award in the space of medicine by the Honorable President of India. And it's a very fulfilling way of, signing off a career on a high. And I always wonder, what do I do from now? Now that I have retired from Unilever, of course, I'm on the board of Apollo Hospitals, but this aspect of caring for people over 30 years and bringing in an element of, compassion, I call it as, a compassionate approach to taking care of our people, makes me believe that I still have a lot left to offer to society. So while I'm exploring opportunity, if nothing happens, I can always walk the ramp. And with that, I think I will end my talk. Thanks, Richard.
Thank you, Raj. That was fantastic. Really amazing journey, and clearly a lot of tread left in your tires for the next stage. I'm sure Apollo Hospitals will be delighted. Now, it's a great pleasure also to welcome now our second speaker, and actually the architect of today's session, Rikard Moen. Rikard is Chief Medical Officer at Optima, and again, like Raj, has had a long and varied experience based on great clinical medicine, but also working in a variety of different industries, most recently with London Transport, heading up the health group there, also working with ExxonMobil, working with within the Middle East quite extensively, actually, with different groups and families, and also in Qatar, where you did some fantastic work, and also I think set up the Occupational Medicine Society there in Qatar, which is part of our International Occupational Medicine Society collaboration. I think the other thing really to just, before I introduce Rikard, is that he is currently leading the remote medicine group in Edinburgh Royal College of Surgeons. And I'd love for you just to say a little bit about that, Rikard, because again, looking at the variety of different roles we have, being able to operate in remote environments, and that actually includes the west of Scotland, as well as some of these more remote environments globally, is increasingly becoming a part of the role. Rikard, over to you.
Thanks, Richard. You threw me a googly on that one. Right, so it's the Faculty of Remote, Rural and Humanitarian Healthcare, which is underneath the Royal College of Surgeons in Edinburgh. And you might ask yourself, how on earth does an occupational physician end up the chairman of a remote healthcare faculty? Well, I think everyone in this call, and as Raj and Richard has touched upon, a large part of what we do is in strange places all around the world, in remote places, and we are the healthcare delivery for those particular parts of the world, especially in low middle income economies. So really the faculty was set up by Alistair Fraser, VP Shell, and myself and the college to really cater for that, to provide a competency framework, to provide qualifications for those medics, for those physicians who are working on those remote sites around the world, but also really now also for the humanitarian sector and anything. But that's a whole different presentation, so I won't use up any more time on that, but thanks for that, Richard. Right, CMO. Well, thanks, Raj. What a fantastic overview of what a CMO does, the life, the role of a CMO, focusing particularly on the professional competencies and the experiences. I'm going to focus very much more on the softer side, the softer skills, the battle scars and the stabs in the back and stabs in the chest that you end up getting through your career. Leadership courses are important, and this series is about leadership, but we're not talking about leadership today. That's taken as read. that's the nuts and bolts of what this role is. You've got to have leadership qualities. So the leadership courses are important. That's a bit like your A levels. You know, that's your founding, and then everything else you build upon that with experience, a bit of luck, and just doing different things. Important to say, we are all different. That's good. No one organization CMO role fits everybody. So whatever kind of personality type you have, there will be a CMO role there for you. And you need to leverage those differences. So, you know, don't try to force a square peg into a round hole. And my first 3 years at ExxonMobil, I kept being told you're a square peg trying to get in the round hole, because that's an organization that's very driven by process, very driven by procedures, policy, and very strategically driven. On the other side, you know, if that's your skill set, that's perfect. That's the sort of company for you. But then if you're on the other side, which is very much more me, you're sort of entrepreneurial, innovative, I like free thinking, if I dare say that, then there are organizations there for you as well. So, you know, whether you're introvert, extrovert, or either those processes, there is a role out there for you. The other thing to say is there's no single way of becoming a CMO. I mean, there's no guaranteed route. There's no textbook that you can follow, which is good, because, you know, be prepared to take a risk. Take a risk every so often in your career, because it means you'll do something different, you'll learn different experiences, and that all builds up, and all that experience builds up, and then you hopefully become more rounded. So, you know, don't be scared to take a risk. So as I say, today is a very personal viewpoint, not the kind of stuff you get in a textbook. Some of it is perhaps a bit off the wall. You can ignore all of it, or just hopefully find some nuggets that are there. But it is important to say that the opportunities are endless. Everyone on this call, when I started out as a very simple occupational physician back in 1999, little did I know I was going to end up in places doing things in parts of the world that I have done. You know, I've been close to being bombed twice. I've been in Kabul, I've been in Mogadishu and Somalia, etc., etc. Those opportunities are there. You just need to look out for them. And I say, be prepared to take a risk. So, what is a CMO? Now, I think the looks on the faces there of Chris Whitty and Patrick Valance says it all. You know, a lot of the time that is the look that you just have to have, because, you know, you're in a position where you're influencing, often without authority. So, as Raj touched upon, for CMO roles, let's cut to the nitty-gritty. The vast majority of CMO roles, you will be contacted by a headhunter, because at that level, that kind of executive level, it's usually the headhunters that will be recruiting you. So this is really just a slide before I sort of go into the more sort of softer stuff of what recruiters might be looking for. And you have to be able to demonstrate that you cope in many different environments, that you can. I mean, COVID is the perfect example.
We've got a question that actually plays into that right now, in fact, about what's an acceptable risk for a newly qualified occupational physician to take in that sort of early career journey towards CMO?
Great question. My advice there would be, get a couple of years under your belt, 3 or 4 years. And, you know, we've all sat in clinics, sit in clinics, learn industry, learn human beings, learn how to deal with managers. Because when you're doing your clinic work, part of what you do is having to negotiate with managers. So that is really where you learn your core. And as Richard said earlier, don't overreach too early. You need to build that up. And often people, you know, they get their membership and all of a sudden they want to be a CMO. That is a mistake, because you run the risk that you will be found out and you will fail, and then you don't get that chance again. So what I would say is, do 3 or 4 years, hard nose, you know, on the coal face, run-of-the-mill occupational medicine, and then after those 3 or 4 years, then start looking for those different routes. Learn to be able to go on the offense, not really just protecting your position. So you got to have a tough skin. They look for leaders who are able to go out of themselves, that don't, in a crisis, are able to become stronger, and don't make it about yourself. You know, they like to hear the we, not the I. So in these situations, mentoring your peers, mentoring the people that work for you. Pose perseverance and resilience, or as Hemingway would say, grace under pressure. You know, that's very important. And be able to demonstrate to the headhunters when they're talking to you that you know how to strategize and how you know to deliver that tactically. Be able to show that you let your mentors, your staff shine, that you're not there trying to take the limelight. And demonstrate that you're not the one that always takes over. You know, it's a bit like I started out as a surgeon. You see one, do one, teach one. You know, you need to teach people, and always remember, legacy counts. So very quick, I mean, we've sort of touched upon this. This is really just, what does CMO actually do? Well, it can be any of these or all of these. We're driven by governance, we're driven by regulations and international standards, but we do everything from, in fact, we do less and less occupational health as we become a CMO. It's more about public health, preventative health, well-being, the mental health of an organization, and tagging into all those bits of an organization. You can see there. I mean, that's a sort of summary of what we do. Ultimately, this is the NIOSH total worker health model. You know, this is kind of what we aspire to within our workplace. And if we can get to there, then we're being pretty good as CMOs. So Richard touched upon earlier what inspired him to be a CMO. You're probably looking at that slide thinking, what on earth's that got to do with anything to be a CMO? Well, that's what got me into occupational medicine. And that was my first CMO role when as I say, I was a surgeon at the time, and I worked for a Middle East royal family. It was their CMO, global CMO, and that was part of the learning. And that was how I first started to do remote healthcare. But that's a whole other presentation to itself. But as Richard said, for him, it was the potteries in Stoke. For me, it was that picture there. So there's no set and defined way. And there, I took a risk. I took a huge risk. I was a middle grade surgeon, but I took a risk. Do I have any regrets now? Not, absolutely not at all. So, really, what are some of the core roles, the core skills that you need? You are ultimately an advocate, internally, externally. You have to control your company's health management systems, and everything you do, you have to understand the importance of clinical governance and quality. That has to drive everything you do, and you have to understand that. You need to be able to look at what you have and not just say, well, that works fine. You've got to be able to look, well, how can I add additional value? How can I innovate? How can I do something new for that organization? Now, some industries are very keen for that. Other industries, oil and gas, perhaps not so. But it's still always important to challenge what you do and what that organization does and what you're gonna do with that. You have to be able to manage people. As a CMO, you will be dealing with anywhere from half a dozen to the most I had at one point at Qatar Petroleum was 580 staff. Seriously, I mean, to have that many staff was just crazy. But anyway, you are there to protect your company, your license to practice, your employees, and then ultimately the customers and the public. So that's what I'm saying. A lot of what you do is really got nothing to do with occupational health. It's a much wider remit. It just happens to be that as occupational physicians, or in the US, if you're a public health physician, this is the kind of remit that you end up in. Your people and human capital are absolutely key. Being a transformer, being able to look at things and work out new relationships, building relationships is important. And a visionary, that ties into that innovation piece. Don't just settle for the status quo. And how you deal with your staff, the mentoring is absolutely key. And one of the things I find most rewarding, and I think all the CMOs on the call also will, one aspect of the job that we're very humble and grateful to be in is our corporate social responsibility. And when you're able to really make a difference in different parts of the world, it's hugely rewarding. And I say very privileged position to be in. A lot of us have a migrant workforce wherever you are in the world. Those 65 countries, a large proportion of that will be local or migrant workers. They deserve the same health rights as any other employee, and we need to look after them. Female labor around the world, sweatshops, we need to be on top of that. We need to control that. Work camps and where our employees, particularly for the contractors, we need to be able to manage that, because we're responsible for what happens on our sites. In certain parts of the world, this is also something that we really need to be cognizant of. We are the conscience of an organization. A CMO, you are the conscience of the organization. And as I said, it's more than just leadership. You really have to have a strong moral compass. I mean, for me, one of the most important skills in being in leadership is those three words there: integrity, fairness, and compassion. And if you have those, you won't go far wrong. You've got to have style and substance. You can bluff for a certain period, but eventually you will be found out. So that's why I'm saying don't go for a senior position too early, because eventually you will be asked to deal with something that you don't know how to deal with. And no matter what kind of pressure you are under, you have to be strong and committed to what you believe. And we influence without authority. And, as I touched upon there, that's we can't force these changes through. I'm a strong believer in don't play dirty. That you will have it, which is why I mentioned you get stabs in your chest, you get stabs in your back. There are people out there who do play dirty. And I believe if you play a straight bat in the long run, you will always see through, maintain that integrity. Leadership you should have. Management skills you can learn. So, you can focus on those. The age-old question, do you focus on your weaknesses or your strengths? Me personally, I would say identify what your weaknesses are, because you need to mitigate for those. You either delegate that out to someone else or have somebody do that for you. Your strengths will look after. And as I said before, you have to be able to be calm. Data, fundamental. You don't have to love data, but you have to understand everything that you do as a CMO is driven by data. You are not dealing, the people you are dealing with to the side of you and above you are not medical people. So they won't understand, well, not they won't understand, they don't appreciate if you bluff them with medicine. You've got to give them data. Why? And you've got to be able to make decisive decisions. Make a decision, move on, make a decision, move on. There's nothing worse than a leadership position who's someone who doesn't. If this is something you've heard yourself say, CMO is not for you. If the phone goes, whatever happens, you're often doing 2 or 3 things at once. Doesn't matter if you're in clinic. That's not the kind of response. You own, as a CMO, you're ultimately accountable. You own what you do. And really just, here's a list of other types of skills that are important to have. Financial skills. You need to understand strategy. Everything you do, as well as being driven by data, has to be evidence-based. Don't try and wing it. Don't just say, well, I have a good feeling about that. Emotional intelligence, fundamental. If you haven't read a book on emotional intelligence, you must. You will not succeed if you are not able to control your emotional intelligence. And now the next level really is political intelligence. Within large organizations, you need to understand how politics work, and particularly if you play politics, how they come back and bite you. Always be personable, always be nice, and learn to be helpfully unhelpful. Never say no, say yes, but then yes, but. You need to manage the people that block your way. You will have to deal with lots of fools. People say, oh, suffer fools gladly. Yes, you do have to suffer fools gladly. People say, don't. I'm afraid you do. And if you can't suffer fools and know how to deal with them, it will be difficult. Whether you choose to do an MBA or not is, if you're early on in your career, I would say absolutely, it's worth doing, because what you're doing to CMO is essentially running a business. You are running a business. Maintain your professional legitimacy, understand your finance. You've got to have resilience. And I'll touch upon this quickly again later. Your friends, your family, your support around you is absolutely key. If you do not have a supportive family, you will work long hours. You will end up, we moved, I think it was a house 9 times in 7 years. You have to have a very understanding wife to do that. And you've got to watch out for your children. When you present to the board, this is kind of how you feel, because when you're trying to present anything, that's the look you will get. Oh, here's the doctor again. He's either bringing trouble or he's asking for money. So you've started already with 3 crosses, and you have to try. And this is why you need data, evidence, and be personable. Be able to present your case. Believe in what you do, and never doubt yourself. You're going to have periods of your life you think, you know what? I'll just go and sit in a clinic, make my cash, and go home at night. And what I always say to people early in their career, never apologize. People always apologize for being ambitious. All of you on this call, I can guarantee you, are ambitious. That's why you're on the call. Don't apologize for that. That's what drives you. That's what makes you become registrar of the faculty, or all the pro bono work that you do. I always say, assume everyone else is smarter than you. Because if you do it the other way around, you're going to make your life difficult. And know who your friends are, and certainly know and keep your enemies even closer. You need to identify those. For everything you do, as I said, facts, prepare. let data drive. Don't wing it. And I'm being slightly facetious by saying stab your enemies in the chest, not in the back. If you're going to do something to someone, be straight with them. Don't play those sort of political games. And with this sort of role, it's not 9 to 5, as I say. And wherever you go, leave a legacy, and that will follow with you. And as you saw on the recruitment, your legacy follows you. And here's somebody whose legacy will certainly follow them. So poor old Deborah Blix. I mean, yeah, this is the conference where ex-President Trump was talking about using bleach and sunlight and injecting bleach into your system. Now, here's the perfect scenario of the role of a CMO. Do you sit there, and just because he's your boss, you don't say a word, or do you stand up and speak? And she didn't, and that would be her legacy going forwards. Just a quick few more. Strive for qualifications. You know, you need that. You need the post-nominals, not for post-nominal sake. That is who you are. That is your reputation. Get involved with the academic bodies, and I say create a reputation. Be prepared to travel. It's a stepwise process. You build. Another tip: 360s are invaluable. I've had about 4 in my career, and I learn something every time from them. Don't just say, "Oh no, that's not me. That doesn't make any sense." That is somebody's interpretation of you. So as I say, ignore them at your peril. If you want to look at planning, have a look around. Look at the CMOs who are 60 plus, and then you know that they will be potentially looking to retire. I would say create a brand. I know that sounds a bit commercial, but create a brand. LinkedIn, through the faculty, through the society. Build that reputation, but build it through LinkedIn, that people know who you are. Because if the headhunters won't know who you are if they've never seen you. And by doing these things, you create your own luck. Never burn your bridges. You build allies throughout your career. Leave a legacy, leave allies. It's never worth burning your bridges. And most importantly of all, I touched upon this before, but warn your family, prepare your family, make sure they are prepared for this, because they need to be on this journey. Just very quickly, before I got my ExxonMobil Middle East health manager role with Exxon, Clarion Johnson, the then global medical director, he actually did a sort of informal interview with at a social event with my wife and myself. She interviewed me more than she interviewed my wife to see if she was prepared to move to the Middle East before I even knew about it. So your family needs to be aware. The snapshot, you end up having an amazing life, doing lots of amazing things all around the world, from dealing with major disasters at the top to being in factories. The one on the left there was the fishmongers. You end up in very humbling situations and meet amazing people all around the world. It's not all good. It's tough as well. You know, I'm sure Richard there flies business class, perhaps even first these days, wherever he goes. But you know, that's not always guaranteed. You may be cooped up at the top left there. That's the Caledonian Sleeper going up to Scotland to urgently get up to a meeting overnight. You know, there are tough things that you need to get into situations, and that's enough for me. I'll hand back.
Thank you so much, Rikard. That was fantastic. I'm going to share my screen for a moment while we just see if there are any questions. We've got a couple of minutes left, and I'd just like to pick up on a couple of things you said there. Don't know if I can share this. Who needs a mentor? One of the things is we all need a mentor, really, and you mentioned that, Rikard. You can go to a party, you know you have to hang your coat up somewhere, but if you don't understand where the coat hooks are, you look stupid and you're carrying your coat around all evening. So, you know, it isn't about the knowledge of what you have to do. It's knowing how the politics works, how it works in the company, in the organization. So they'll tell you where the coat hooks are and they'll allow you to do what you do. So great advice on that one. I think the other one that I would say, you know, really is, I'd leave people with a couple of points, really. I don't know if I can make a slide move on this, but the data, you mentioned the data again, you know, really critical. These are just a couple of things that the questions that I ask all my team. You don't go and have a conversation with a board or a senior leader unless you can answer all 6. Show me the data. They need to have some data. What is it telling you? What are your insights? Why is what's worrying you should be getting me up at night? What should we do and where should we start and how will we know we're making a difference? Very simple questions, but unless you can walk into an office or you can walk into a conversation without these, you're likely to be reversed back. Sadly, I don't get first class travel, unfortunately, Rikard, but rather like you, I've had this sort of armed front and back in some of these rather difficult locations. The one thing I do take with me is my Irish passport, because sometimes it's better to be Irish when you're traveling to some of these places. Right, we have literally a couple of minutes, and then I know I'm going on to another Zoom call. I'm sure others are. Anyone want to ask a last question? Just open the line and ask away. But otherwise, I just want to thank Raj, Rikard, for fantastic presentations, and to Nick and Nick Llewellyn and the team at the SOM for pulling the session together. Really great. And thanks everybody for coming along and making it a great session.
Hey, I've got a question.
Go for it, Abena.
I was going to say thank you so much for those really insightful presentations. It was fantastic and something I've been really looking forward to. I wanted to learn more about what, you know, from all of you really, what kind of sacrifices have you had to make in becoming CMOs of your organization? It sounds like obviously it's an all-encompassing role. It takes you across the world and back. And obviously Rikard pointed out, warn your family. So I'd love to hear a little bit more about what that actually meant for you on the ground.
Well, I'll do a quick one. I don't think the sacrifice is actually what you do is you be the person you always were. You just hopefully have somebody who tolerates that while you're on that journey. I left clinical medicine. People thought that was a sacrifice. Actually, it was the best thing I ever did. You know, when you're a registrar, you're doing an MD, and you're that close to a consultant post, this looks to be a very strange decision, a bit of a sacrifice. It wasn't. So be the person you want to be, take the role, take the career journey you want to be. I think if you're in a partnership, you know, you just have to work that out together, because there will be a yin and yang in terms of who gets to do what and where. If you're going to, and having two careers, you know, dual careers is not impossible. It is not impossible, but it may mean you have to do other things to help with childcare and other things. Raj, any comments?
Yes, you know, my wife is actually a trained surgeon and an anatomist. So I have been blessed with having someone who understands the role of a doctor. But any sacrifice which has happened, as far as I'm concerned, is made by my wife, because when she got married to me, she had just got admitted into Stanley Medical College in Chennai in India for a plastic surgery MS, a Master of Surgery. And she left plastic surgery and married me and came over and became an anatomist. So she's retired as a professor of anatomy and surgery. So the sacrifice was always on the family front, not on my front. So I think I've been very blessed in having a very understanding family.
And I'll leave the final word to Rikard to share your gem and close the session. Rikard, over to you.
Thanks, Richard. I also travel with a second passport. I travel with a Norwegian passport to those unsavory places, just like you, in case you need to get out. Similar to Richard, and not a sacrifice, but you know, I gave up a surgical career because I'd found a different dream to do. So Richard will always be a recovering physician. I'll always be a recovering surgeon. But that was a risk. It was a big risk. My mentors at the time thought I was absolutely nuts, absolutely crazy. You've worked so hard to get your FRCS. What on earth are you doing? So don't be scared to take a risk. And potentially what looks like making a sacrifice probably isn't. But again, I'll touch upon the family. And you know, I know we've said this a few times, but it's so important. Certainly when I was doing a couple of global roles, I was away probably 3 weeks out of 4. So that was when my children were between the ages of probably 4 and 10 during that period. So yes, I missed out on a chunk of them growing up. Being a CMO, it potentially is quite selfish. So, but you need to be prepared for that, and you need to really have your family and your partner in agreement that they can go along that journey, because it's not worth sacrificing your family. And a lot of expats who go on expat assignments end up sacrificing their marriages. It's not worth that. So that would be a cautionary. So you don't have to sacrifice that. Would be
great advice, Rikard.
So Richard, just a couple of things. It's also very exciting, you know, when you travel around the world, you have a strange amount of very interesting experiences. For instance, when I went into Mexico, they stamped my passport on the way in, But when I came out, they said that, look, I don't need to have it stamped when I got out, but I was very scared. So I went back again around the counter where somebody, asked me to go. They stamped it for me. And then I realized that they had put in 2 stamps for inward journey, but none for the outward. And I was very scared of getting back to Mexico the next time. In Russia, when I went in, they didn't ask me anything. But when I came out, they said that you have not shown this passport to this guy, therefore you need to pay a fine of $500. Obviously, he was trying to extract money from him, and given the Unilever training, there's no way I would have bargained to do anything. I said, I'm sorry, I'm not going out. That's it. You guys didn't tell me. So you get all sorts of experiences from across the world. And I also remember where once my boss accompanied me on the travel, and he was carrying a small son with him. Some mix up in the passport, he carried the wrong passport, and the guy said that both of you can't go. And my boss, being what he was, he said, look, I understand that I have come with my son. Now this son, I'm going to leave here. If you tell me that he's not going to go inside, it's your responsibility. I'm walking out. And they allowed his son to go. So hilarious, strange things happen in the world of travel. And these are all experiences worth cherishing. I just told you a few for lack of time. Otherwise, for all the 100 countries I travel, is one story or the other.
Richard, can I just give a final quick tip on the back of that? So I actually traveled with 3 passports, 1 Norwegian, 2 British. So what I would say is travel with 2 passports, 1 clean, 1 dirty. So you use one for Afghanistan, Iraq, Somalia, Mali, all these places. If you look at my dirty passport, you would think I was working for a unfriendly organization trying to blow up things. So have 1 clean, 1 dirty, and keep them separate.
Listen, we could go on for another hour, but I'm just going to close the session and again thank all speakers and everyone who's chosen to join us. And please do join us on the next session. Have a great day. Have a great rest.
Thank you, everyone.